I am a general orthopedic surgeon, so I take care of most general kinds of common things, especially hip, knee, ankle, shoulder problems. We take care of arthritis, hip and knee arthritis.
So obviously every patient, every problem is a little bit different and unique to the specific patient. And I definitely try to have a very conservative approach to taking care of patients. So the first option for a lot of patients is to try physical therapy or to try injections. Typically patients will get x-rays to evaluate how things are going. And some patients do end up needing surgery of their joints, but that's always the last resort after you've tried those other things.
Well, I think one of the newer techniques in orthopedic surgery, especially for joint replacements, is we're doing things more specialized or patient-specific. We use computerized navigation during knee replacement surgery that really allows us to line up the knee replacement according to the patient. It maps the patient's hip, their knee, their ankle. So when I put a knee replacement in, it centers it specifically for that patient.
My leg just got worse and worse. He said, well, we're giving it shots, but I think the only thing, and you consider this now, is an operation, a total knee replacement. And I said, I'm just going to go with what Dr. Baumer says, and he put me at ease. And so we went through the first operation, and it was great.
Well, the process actually started when I came in the next day after the game. My knee was really swollen and it hurted really bad. So when Dr. Hughes came, he gave me all these examinations, but like when he told me to get up and walk, I would do it easily and he was confused. So he told me to come to the center, get an MRI and get a scan on my knee to see what happened. When he showed me the pictures, I didn't think it was that bad, and it was pretty bad. It was an injury that you don't see very often because it came out the root of the bone. After that, he said, I'm gonna need surgery, and he really focused on after football, like when I get older. And that was really touching to me because he was looking out for my best interest later on in life. So he gave me an option of repairing it or just carving it out. Because when you hear meniscus tear, usually they just carve it out and call it a day, put you back on the field 2 weeks later. Well, he gave me an option. He said, we'll try to repair it, and if not, I'll just have to carve it out. So when we went into surgery, he actually repaired it. But he didn't know the chances of me actually being able to repair it.
Well, I've been together with Dr. Simmons for a good long while, and so they do some things that are a little different. They do some hip replacements that are a little bit better for younger people, and then they have some different techniques with computer-aided navigation or custom-specific jigs that are helpful, certainly, and I've occasionally had a patient that's the best thing for, and so I've sent them to see Dr. Simmons because their special interest is more appropriate for that patient.
The center itself is great too. The nurses, the anesthesiologists, all of them, they were great. They were nice, very generous. If someone asked me about Dr. Hughes, I would definitely recommend him, Dr. Hughes. When I thanked him so many times at the last game, he was like, anyone could have did this, any surgeon could have. I looked at him like, yeah, probably, but not the way you did it. For the simple fact, you don't see my injury too often at all. So I would definitely recommend anybody. I'm from St. Louis. I would recommend anybody to go to Dr. Hughes.